Okay, now we're going to talk about a more specific liver test called bile acids and how it relates to a condition called porto-systemic shunt and how it relates to fat absorption. It all matters. So as I said, if you've taken your dog in and they have some abnormal liver values on their regular blood work, the vet may request a bile acids test. It's just more specific for liver function. So what does it mean if they're elevated or low? Well, first of all, what are bile acids or bile salts or bile? It's kind of all interchangeable for our purposes here. The hepatocytes, which are liver cells, make bile in small amounts and they send it through some tubules to the gallbladder where it's stored in a larger amount until we eat a fatty meal. When we, or our dogs, eat a meal with fat, the gallbladder empties into the intestines and it emulsifies and coats the fat so that they can be absorbed. Well, this happens because fats are different from proteins and carbs. They're different because every cell in our body is coated with fat. It's called a lipid bilayer. Lipid just means fat. And it's a double-sided layer that surrounds every cell, the trillions of cells in our body, brain cells, heart cells, intestinal cells, skin cells, whatever. That protects things from leaking in and out because the fat is kind of impermeable, kind of like when you see a drop of fat in water and they repel each other. Liquid things can't get in or out of the cell without the cell's permission. So there's channels and gateways and enzymes and little things in the lining of the cell that allow the cell to take in and out what it wants, but it makes its own choices on that. Things don't just get to go in and out unsupervised. So that's why all cells are layered in fat, including the intestinal cells where our nutrients are absorbed. Well, for proteins and carbs, this is okay. They can get through. But fats is like having two wrong ends of a magnet together. The fat layer of the cell and the fat in the food you digested, they just, like two ends of a magnet. They won't go together. They won't pass through. The bile comes into the intestine and coats the fat and emulsifies it so that it can be absorbed into the bloodstream. Okay, so bile really matters for fat. After that, after it gets into the bloodstream and the fat's absorbed, the bile gets recycled. It goes directly back to the liver. The liver cleans it up or does whatever it does to it and puts it back into the gallbladder to be ready for the next meal. So what this means is if we're going to test the bile acids in the blood, there shouldn't really be hardly any bile acids in the blood. And there should only be some in the blood if we just had a meal and they were active transporting the fat. In that case, they might be kind of high in the blood for the first hour or two after you eat, and then they should go back to 0 or close to 0. So if they're not doing that, something's wrong. So first of all, if they're low, which isn't that common, if they're low, it really means there's a serious liver problem and the liver's not making the bile. And that's a pretty big deal. More often, though, I think we test things for high bile acids, and that's usually in a condition called porto-systemic shunt. It's a shunt. That name implies a shunt means that the blood or whatever it is goes around something. That's what a shunt is. So in this case, a porto-systemic shunt, the blood flow is bypassing the liver. So the bile acids aren't getting reabsorbed by the liver, and they're staying high in the blood all the time. Well, we need a little more understanding of why that's happening and what that means now that we've gotten there. So the porto-systemic shunt, portal refers to the portal blood system that's separate from everything else in the body. There's a separate blood flow system that comes from the intestines where your food is absorbed directly to your liver before it goes to your heart or your brain or anywhere else. And the liver does its job of detoxifying all the chemicals and whatever's in there needs to come out because our modern processed food system is full of preservatives and artificial chemicals and food coloring and toxins and glyphosate and just the list goes on and on and on. Your liver's job is to clean that stuff up. So that's the portal blood system. It goes directly to the liver. However, in the womb, the porto-systemic shunt is usually a younger dog problem. And that's because in the womb, human or dog, or many other animals, except for horses and a few others, horses and a few other animals don't have a gallbladder because they do not eat fat. They eat grass only, no grains, no fats. Carnivores eat fat and have to have a gallbladder to have bile to emulsify the fat to absorb it properly. Anyway, in the womb, all your nutrition is coming from the umbilical cord from your mom. And all that blood is being cleaned up by your mom's liver. So there's a shunt. There's a little pathway that goes around the liver. It's called a porto-systemic shunt. It's the portal blood system that comes from the intestines, and it bypasses the liver and goes to the system, the whole body. It shunts around because you don't need your liver. You don't need to clean any toxins out of your blood because your mom's liver is doing that for you through the umbilical cord. However, shortly after you're born, that porto-systemic shunt needs to start closing down due to hormones and all sorts of things. It's a natural process. It happens. It starts closing out. As it does close down, the blood has to start getting forced to go through the liver because it can't go this other way anymore. And the liver starts doing its job of cleaning things out. Some breeds, whether it's breeding or genetics or whatever's happened, some breeds, the porto-systemic shunt doesn't close, it stays open. And therefore, the liver doesn't detoxify and all these things happen. And the bile acids will be high because the liver's not reabsorbing them. If that's happened, there's a surgery to fix that. We just go in and we tie down that porto-systemic shunt kind of slowly and squeeze it off so the blood will start going through the liver. Not that big of a deal. There's another problem with some dogs, and it's more about the designer breed, and we're making dogs tinier and tinier to fit in purses and pockets. But when you make a dog that small, 2 pounds or under, its liver is really, really tiny. And the blood vessels through the liver, where the blood has to flow to get cleaned out and detoxified, they're really, really tiny. They're so tiny that the blood can't really flow through there easily. So in these small, tiny, miniature designer breeds, the shunt will close like it's supposed to, or it'll at least try to. But as it starts forcing the blood to go through the liver to get cleaned out, detoxified, the liver blood vessels are too tiny. It can't get through there. So it'll kind of force the shunt back open. This is called microvascular dysplasia. Micro means small, vascular means blood vessels, dysplasia means abnormality. So this means the liver blood vessels are too small that the blood can't get through them. So it kind of reopens the shunt because it's easier to force that open. So in either case, whichever one, then there's not really a solution for that for these tiny dogs. It's the breeding, it's the genetics, and we don't have a way to fix that because their liver is just too tiny. But either of these cases, the blood coming from the intestines is not getting filtered properly by the liver. So the bile acids aren't getting reuptaken by the liver and recycled. So they're just high in the blood all the time. The bile acid test will find that and help you make this diagnosis. There's also a lot of other things you'll find on the blood work that we talked about in other videos, like with urea, with BUN, with ammonia. There's a lot of other things you'll find if the liver's not doing its job properly. But that's what bile acids is about. And that's a little bit about if you have a small dog with a porto-systemic shunt or a liver shunt, that's basically what's happening. So hopefully that helps you understand it better. Thanks.